Hello, okay, so Marcus Falls, a quick video today, and we're going to discuss an attempted vaginal delivery following a previous C-section. And I want to follow up a little bit more on this because I did a video a couple of days ago, probably a couple of weeks ago, in which I talked about a uterine rupture and a traumatic brain injury. And in our context, that traumatic brain injury is HIE, or hypoxic ischemic encephalopathy, and that is a reduction in blood and oxygen, which can lead a baby to suffer a brain injury. And when you have a uterine rupture, especially if it creates an emergency, which they oftentimes do, you are going to have doctors usually moving to an emergency C-section when warranted. And so I had questions about the section in which I talked about a vaginal delivery following a previous C-section. And so I want to talk with you all today about that issue from a medical legal standpoint and how we see that issue when families contact us. And so first and foremost, mothers who go on to have a vaginal delivery following a previous C-section, the literature out there is that this is safe. I mean, normally moms do not have any problems by going this route. As I always say though, it's always important that you should take the time and talk with your medical professionals about whether you are a good candidate for this procedure. And so they can take your factual situation and your history and all of that, they can take that into consideration and advise you properly. But when we have families that contact us about this issue, one of the areas that we are looking at is what was going on with mom. Generally, there's been a uterine rupture, and in some cases the baby has suffered that traumatic brain injury, that HIE diagnosis. And when we're going back and we're looking, one of the areas we're looking at is, was mom in a prolonged delivery? Was there a prolonged labor and delivery going on? And by that, what I mean is, let's say, for example, mom is not progressing, mom is not dilating, mom's not opening up with things, and she's pretty much stuck. And so if that is going on, then of course doctors gotta pay attention to that, especially if there's already a previous C-section that's out there, and also too, depending on the cut on how that C-section was performed. So these are things that doctors and nurses have to pay attention to. In addition to that prolonged labor and delivery aspect of things, also, what's going on the fetal heart strips? I mean, what is the monitor saying? Is the monitor saying that the baby may be in a condition called fetal distress? Are there problems on that monitor? So all of these types of things, doctors and nurses, they have to take the time to pay attention to, because if they don't and these problems come up and they're not properly diagnosed and the proper action is not taken, then of course, it stands to reason that the baby may suffer a traumatic brain injury like HIE. If you have more questions, you'd like to talk with me further, maybe you are watching this video today because you have suffered a uterine rupture and you had a previous C-section going on, and your baby has now suffered a traumatic brain injury, you have questions, the telephone number on the screen, I invite you to go ahead and pick up that phone and call me. When you contact me and you talk with my secretary, let them know that you would like to get on my calendar and talk with us about everything. It doesn't cost you anything to talk with us about your baby story. Make sure though when you call that you pick a date and a time. That is important, a date and a time, okay? And so we can know when to call and everything like that. One more thing before I get out of here, I practice law in the state of Maryland. I know this video is on the internet and I can't control who's going to watch it, social media sites and things like that. If you're not in Maryland and you reach out and you contact me at my office, just make sure that you understand that we have to use what we call co-counsel or local counsel, in other words, an attorney in your state. That's something that we can help and work with you on, but I just want to make sure that you understand that co-counsel or local counsel aspect of things. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law in the state of Maryland at Boston Law Group, LLC. We'll talk with you next time. Take care and enjoy the rest of your day.